Hello, good evening, everyone. I'm Dr. Ameen. I'm a naturopath and I'm also a specialist in functional medicine. And I welcome you all to Organic India Insta Live series. It is first of a series of, these sessions, interactive sessions with the experts going to come in the future. And in this particular session, we are going to talk about joint health, which is very, very important. So usually when I communicate, I always start the session with something very positive, but then we live in a time where the word positive is the most negative word because of the COVID. So I will start with something I just came across. It's very interesting. It's a Persian proverb. It goes like, I curse the fact that I didn't have shoes until I saw someone who didn't even have legs. So we really need to become appreciative of what we have, especially when it comes to health, because sometimes health is the most important vital element of all. So let's straight away jump into the topic of health itself, particularly joint related health. Okay, so we all, if we live long enough, we all have some other form of joint related issues, and there are studies which basically shows that, particularly statistic studies, it shows that at least about 1/3 of adults, they all are suffering from joint related issues. 1/3, that's about 35% of adult population. And it's very important to notice that a lot of them are taking a lot of prescription drugs like painkillers, NSAIDs, just to survive. They are like popping all these paracetamols on daily basis to survive. And mostly we don't pay much attention to it because I think the medical community basically says that you just have to live with it. On the other side of it, we also don't explore so much because some of you all just try, but it's just like one little thing. We're always constantly looking for this magic bullet which you just pop in your mouth and your pain completely gone. It just doesn't work that way when it comes to health. I always tell my patients about one comparison, an anecdote. So this one, think of, some of you all may be driving cars, right? So you're just driving car along the highway, then you suddenly notice there's a blinker comes in front of you. So when it comes, what do? It's a car, and basically it's a warning sign. You instantly pull over, and then you start to check, and then you eventually decide to take your car to the mechanic, and the mechanic basically takes a scissors and just cut the wire to that particular blinker light, and he says, problem fixed, don't worry about it, go ahead and drive. We will never accept it, correct? It's after all a car, and the car, if it breaks down, you can always find another one. It's not a problem. But when it comes to your body, maybe you're not exercising right, maybe you are just too much weight, maybe there is nutritional deficiencies, maybe some autoimmune disorders. There are so many different health related issues, right, that can cause joint related pain. But most often than not, you're just popping a painkiller and going about your day-to-day life and not really inquiring into why am I having these issues. It's very important to look back into it. And that is my intention of today's discussion, to go a little bit deep into the joint related information and talk about your food, herbs, what else naturally you can do, how to manage all this. So that's primarily the purpose of this particular talk. Now, what causes arthritis or joint related issues? What are the primary reasons? One of the very important elements is just aging itself. We end up overusing the joints, and there's a lot of degenerative changes, damages, particularly sport related injuries. So this is one of the primary reasons for joint related issues. The second one, repetitive usage. You would have seen about people typing constantly and their fingers start to hurt. Job related, it's all about repetitive use. The badminton players have a lot of shoulder related arthritis. So these are all very specific. The third one is going to be basically injuries. If you are just injured, particularly football players, happens in the ankles and their knees. Repetitive injuries also causes the same kind of arthritis changes over a long term. And very most important, particularly for Indians, very most important is very poor posture. You see them rounding all the time. They don't keep a straight back. They don't watch their posture, which is also a primary challenge also. And then just two more. The last but one is basically the autoimmune disorder. These are the conditions where it's called rheumatoid arthritis, psoriatic arthritis, where the joints are kind of swollen, and really painful and inflamed, red, cannot move, the joint kind of deforms. It all happens because your body's immune system turns against your joint. Thinks like your joint is an enemy and start attacking it. So there's nothing wrong with the joint, but your immune system is attacking the joint. So that's another group. And the last and final one is just lack of sleep. Have you ever tried it? You just don't sleep like one night, two nights, then you will start to notice the morning when you wake up, the joints start to hurt badly. You attempt to pull a muscle, and there is always degenerative changes. So that all happens because of this lack of sleep itself, which is a primary chronic problem in today's world. So other than that, okay, so now we kind of know what causes it. And of course, the most important element is also like the lack of nutrients. Like, your joints, it needs like, collagen, it needs enough of lubrication, hydration, you need vitamin D, calcium, magnesium, lot of minerals and anti-inflammatory chemicals, everything you require in order to keep the joint very functional. Whenever there is a poor diet and the lifestyle factors are very bad, then that also causes a lot of degenerative related disorders. So it also becomes very important to make some lifestyle changes, which we will look into further in detail. Okay, I'm being a naturopath and I'm also expert in the field of functional medicine. So we try to integrate the East and West more from the nutritional perspective to give the best of solutions to most of the arthritis related cases. So the first thing is, I'm sure you all heard about like mustard pack. Like, we just take like dry mustard powder. Like you take the black mustard, you blend it into a fine powder, and take this powder, about 2 or 3 tablespoons of it, add a little bit of hot water to it. So when you mix the hot water, it becomes like a little bit like a paste. And if at all your pain is very bad, you can always add a little bit of garlic, like pound a few cloves of garlic paste and mix it into it and apply on the joints. It almost instantly lowers the swelling and as well as reduces inflammation. This particular mixture is very rich in sulfur and as well as all the other organic acid, which basically reduces inflammation in your joints itself, and you feel so much better to that. But those who have very sensitive skin, you need to be very careful because sometimes the mustard can be quite acidic and it can irritate the skin. So don't go more than like 15 minutes, probably 20 minutes. Don't go beyond that. And particularly if you have like very fast skin, you need to be extremely careful about when you're using this. It is particularly for like those who have like chronic degenerative changes like osteoarthritis of the knee, and as well as like elbow, tennis elbow, those cases it works amazingly. The other thing you can actually do is very important, find a balanced diet. So make sure in your diet, like sometimes in the name of vegetarian, like we Indians, we have a lot of vegetarians. They are primarily carbotarians. You see, like they don't eat really enough of vegetables as such, and there's a serious lack of protein. So it's primarily carbs. It's like rotis and dosa and idli and rice, and you take like little bit of vegetable, little bit of all that, which doesn't exactly help when you think about it. So rather, make sure there is enough of protein, whether it is like beans, peas, lentils, tofu, or those who are non-vegetarian friends, you can eat a lot of fish. Fish is rich in omega-3, which can be excellent for joint-related conditions. And on the other hand, make sure at least 1/3 of your plate is full of vegetables. It can be especially green leafy vegetables. They are rich in calcium. They are rich in all the other organic acids, which is excellent for the joints, which is very, very important to eat. And then the other 1/3 can be your carbs and fat, a mix of that. So every time when you eat a balanced meal, you can really notice the improvement in your joints. The next one is movement. Most often than not, when people have like arthritis, they just refuse to move. Like they don't move the joint at all, which is very bad. Maintaining the range of movement is one of the very essential aspect of maintaining a healthy joint. So that's why you notice, particularly those practice yoga, the range of movement is excellent. And in old age, the amount of range of movement, like how far you can move, determines how old you are. Like when we think about young, they're very flexible and supple, very soft. Like think of like a very grass, a leaf. You can bend it, nothing happens. When you become stiff, it's like a stick, a dried stick. When you try to bend it, it kind of breaks. So that's what aging is all about. So you want to maintain and preserve your flexibility by making sure that you move that particular joint which you have pain. And if you don't have pain, it's excellent. All the more reason you want to preserve it. So move. do yoga every day, which is very important. And of course, there's a lot of confusion, like, about should I apply heat or should I apply ice? Some doctor says, yeah, apply hot. Some doctor says, yeah, apply cold. So what is the science behind it? The logic goes like this. Whenever you have a joint and you see it is red and it is inflamed, there's a lot of pain, means the inflammation is very active. In that case, you ice it. So when you apply ice, it basically lowers the inflammation, it moves fluids away from that, and the joint kind of starts to get better. But on the other hand, like, elderly, they have this knee stiffness, making a lot of noise, but there's no swelling, but it's internally, it just pains when you move it. In those cases, don't apply ice. You try to apply heat. So when you apply the heat, now what happens is that can improve the blood flow, warms up the joint, so they start to feel a lot better. So in those cases, we apply heat. So that's the logic behind applying cold and applying heat. And sometimes you can apply cold in the early mornings, because throughout the day you're going to use the joint. It kind of improves the range of motion, it kind of warms up the joint and things like that. And before bedtime you can apply heat, because you're just improving the blood flow to that area, so the organ repair happens when you're sleeping. So that's also a better way to look at it. So you can also do that. Now the other one is, you all might have heard about something called Epsom salt. Epsom salt is basically called magnesium sulfate, and magnesium is a fantastic relaxant, and sulfur is a generalized anti-inflammatory. So say somebody have like pain in the ankle, you take a bucket of warm water, put about 2 or 3 tablespoons of Epsom salt. It is EPSOM, Epsom salt. We can find in most pharmacies. You just put about 2-3 tablespoons and soak your legs for about 15-20 minutes time, and you will notice a big improvement, particularly those who have sleep related disorders. You can't sleep in the night, you do this, it really helps. Your sleep kind of gets much better. The other one, of course, most of the people have joint problem because of the excessive weight. So reducing weight, like there are studies which shows if people lose about 10% of their body weight, the arthritis almost disappears, particularly the weight related degenerative changes almost disappears. And I have seen it so many times. So it's very important to lose weight, lose around, like aim at 10% from wherever you are standing at this moment, particularly if you're overweight. That's what is primarily is feasible also. So that's excellent. And the last but the other point is basically support your joint. Like if you have pain in the wrist, get a nice band to support the wrist. The same goes with the knees, the same goes with the neck. Wherever you have degenerative changes, make sure you support the particular joint, which is very essential as well. And then in natural medicine, we have so many different methods, particularly acupuncture. Acupuncture works fantastic when it comes to joint related aches and pains, degenerative changes. All these conditions get so much better. Even WHO, World Health Organization, recognizes acupuncture as one of a very good, valuable treatment for joint related, arthritis related conditions, particularly for back pain. And the other thing is massages. When you go for massages, just make sure that you go to professionals who really know what they are doing, instead of randomly trying something and you end up injuring yourself. But you can try massages. There are a lot of different techniques. They have this typical of a wonderful Ayurvedic massage, then there is deep tissue, there are tissue release techniques, and most importantly chiropractors. Nowadays we can find a lot of chiropractors who are very good at adjusting your spine, improving your joint function. So you can always take help from them as well. It works fantastic. And also use a lot of saunas. It's the nicest way to warm up your body. When you use sauna, sit in a hot room and you feel so much better. And definitely seek help from Ayurveda. Talking about Ayurveda has been phenomenal when it comes to arthritis and joint health. It's more about, we are talking so much about recovering from arthritis, but what is also important is to preserve your joint health. You may be 30, 40, 50 years old. You don't want to suffer through those kind of pain. It's very vital to preserve what you have. So here we are going to talk so much about the herbs from the perspective of preserving your health, what you have. When it comes to joint health, the number one herb that is most valued is turmeric. And turmeric, not all form of turmeric. So turmeric has something called curcumin. Curcumin is the active ingredient that is found in turmeric. If you have like 100 grams of turmeric, normal turmeric what we use in home for cooking, it only has around 2%. That's like 2 grams of curcuminoids. And if you buy something organic, it can go up to like 7 grams for 100 gram. But these curcuminoids are very well known, and it is usually considered as one of the painkillers. We have this NICE, and it's called NSAIDs, non-steroidal anti-inflammatory drugs. It's supposed to be as effective as that. So if you are into popping up a lot of pills for your joint related aches and pains or muscular aches and pains, please try turmeric. Give it a chance. It will probably relieve all your pain, and your requirement for painkillers will reduce tremendously. It's fantastic. All right. The other thing, of course, when it comes to turmeric, you want to look into it, because turmeric is not readily absorbed by your body. So you want to use a lot of pepper, you want to use ginger and elements like that. And one of the things I use is from Organic India. I use it all the time. So I have this thing called Turmeric Formula from Organic India. It works phenomenal. So it's like they already have created the right kind of formulation. It's a very high concentrated organic curcuminoid extract. Works just fine. And any kind of painful conditions, especially when it comes to digestive related disorders or joint related diseases, it's fantastic. Do you know that turmeric is basically called as a natural chemotherapy agent, which actually means it's as effective as a chemotherapeutic drug in both curing and preventing cancer. So you don't want to wait until the cancer develops, rather take it, because nowadays I think the incidence of cancer is almost like 1 in 4, and that's a very, very high incidence worldwide. So you definitely want to take it. So there's a lot of other good side effects to it. So it's fantastic. And it's also a very good antioxidant. And turmeric is a very powerful anti-inflammatory. It's also very potent anti-cancerous. So you have so many different benefits out of it. And there's nothing wrong. And of course, add more turmeric in your cooking. You must explore something called turmeric tea. And there's a lot of Ayurvedic formulations nowadays coming up. You can just buy a tea bag with turmeric in it. You just leave it in hot water, and there is your turmeric tea, and it tastes fantastic. So you can also just try that, which is excellent as well. And the other benefits, naturally, turmeric is excellent for losing weight, and it's fantastic for managing diabetes. So that is something you can actually definitely use it. There are other herbs. You must have heard about something called harjot. We call it quadrangularis. In Tamil, we call it pirandai. So this is one of the fantastic herbs. So it's actually used very much in broken bones. Whenever they have the bone fracture, there have been studies which shows when they use this particular herb, all right, the bone heals about 30 to 50% faster. And this is also one of the herbs that has the richest amount of calcium, phosphorus, vitamin C, amarin. There are a lot of different minerals which naturally supports the body's healing power. So that's a very, very great herb, which is also rich in vitamin C also, so which is very good. And the next one, we call it the Natural Multivitamin. Make a guess what it is? It's basically moringa. Moringa is a fantastic herb. It has almost about 40 plus different antioxidants. It has about 90 different nutrients. It is one of the highest protein containing herb, and also it has vitamin A, B, C, D, E, every form of vitamins, also calcium. It has so much richer calcium. It is much better, 20 times more calcium than of that of milk, and 4 times more iron than that of spinach. It's fantastic herb. So you want to take a lot of moringa, and as well as the same way we might have heard about this particular herb called Shatavari. So Shatavari is the herb particularly it's for men's health. We use a lot for women because they are the ones who have the very weak bones. And for bone health, it is very vital to use a lot of Shatavari. And why am I talking about these particular herbal combinations? You want to go out there and look for harjot, which is basically the prandai, and as well as the moringa leaves, and as well as Shatavari. These are all the excellent formulations which specifically supports your joint related health, particularly those who have bone related issues, osteoporosis. It's fantastic. So I think one of the herb you can find with all this beautiful combination is something called Osteocell. It is there in Organic India. You should definitely check it out, particularly if you're 50 and above, particularly for women who have menopause. You have a very high tendency to lose the calcium from your bones. And when you take this particular herb called Osteocell, which basically combines Shatavari, which is excellent for women, and moringa, which is also rich in nutrients, and as well as the harjot, which basically makes the bone stronger. So the fracture rate drops tremendously. Well, the herb name is, it's called harjot, or we call it quadrangularis. So this is the specific names. If you want it's called Cissus quadrangularis. So that's the name of that particular herb, which is excellent for the bone, bone fracture and bone health itself. So that's excellent. So you can actually take this formulation, and so this is more towards like strengthening your bones and improving the health of the bones. From Ayurvedic side, the other formulations what we use is basically, like, you might have heard about something called Motha. Motha is like Cyprus rotundus. That's the biological name. So Motha is also fantastic. Like, otherwise in Sanskrit we call it Musta. I think that's how it is called in Kerala, Malayalam. So Musta is also a fantastic herb. So it is very, very cooling in nature. So particularly this is more for inflammation of the joints, those have red, swollen, rheumatoid arthritis conditions. So when they take Musta, the inflammation reduces, the swelling basically reduces. It's fantastic. So that's actually very good. It also has very high content of like certain alkaloids. It's a fantastic immune booster, because mostly earlier I mentioned that autoimmune disorder where the immune system is attacking the joint. So Motha is a fantastic immunomodulator. It works exactly like Tulsi. Tulsi is also a herb which also like stabilizes your immune system. Your immune system doesn't get too aggressive, so the condition kind of gets much better. And we also use Motha as a antidote for poisonous, like bites. Like sometimes things kind of bite, it swells up. You can use Motha internally and as well as blend it, make a decoction of it, just apply like a paste on it. It gets better as well. So it's also excellent for that. And the other thing is, why people develop joint problems. There's a lot of nutritional deficiencies. So the body doesn't, like you feel weak, right? But particularly if you have like a long-term fever right after surgery, the joints always feel very weak. One of the greatest herb Ayurveda recommends is Ashwagandha. Ashwagandha is a phenomenal herb. Naturally, it's like very warm herb, like hot. Like if your stomach is very heaty, we advise you against it. But it kind of warms up the body, particularly those who have arthritis. It's a cold disorder, you feel very cold, right? So when you take that, it kind of gets better as well. Ashwagandha is also called as the Indian ginseng, and there are studies which basically shows that it works better than some of the NSAIDs, like non-steroidal anti-inflammatory drugs, which are usually prescribed for all form of joint related issues. So it actually works fantastic. So that's also great. And it also rich in iron, it is rich in amino acid. Particularly for men, it is known to increase testosterone, because men tend to lose testosterone. That's primary reason for gaining weight and as well as developing a lot of joint related issues. And so yes, that's also something you can take. And because Ashwagandha, I think it's a very commonly available herb, and you can always just go and look for it. So that's something very commonly available. But I think Organic India does have a very good quality organic Ashwagandha. You can always take that. And the next herb, I think when it comes to joint problems, predominantly most people have something called autoimmune disorder, especially when it comes to psoriasis. Like they have psoriatic arthritis, because the skin condition eventually affects the joints, and rheumatoid arthritis, which also affects. Then they have SLEs. There are so many different conditions that can affect the joints, primarily in all these cases where the immune system is involved in it. So when you're talking about immune system, in Ayurveda, one of the primary herb we always rely is called Guduchi. Some of them call it Guruchi, and they have different names. In English, it's called Tinospora cardifolia, which is a fantastic herb. It just kind of calms down your immune system, really lowers the inflammation, and you already start to notice the joint kind of start to perform fantastic. So Guduchi, very vital. The way it works, I think in the southern part of India, we call it Amirdavalli. So that's the name of it. And the way it works is, it's one of the richest, it's an ingredient called beta-cytosterol, which is a very powerful phytochemical to protect the joints. It's also rich in calcium, phosphorus, iron, copper and zinc. Both are immunomodulators. The way Tinospora cardifolia works is by creating the balance between copper and zinc. And I can tell you, most of our population is very low in copper and zinc. So that becomes very important. The other herb I can think of is basically tulsi. Especially in tulsi, we have like 3 different type of tulsis, like Krishna tulsi, Rama tulsi, Vana tulsi. You can see the different color changes and things like that. But all kind of tulsis works fantastic for immune system related joint problems. So to specify the immune system, particularly to reduce the stress, you can use tulsi. Okay, so this particular combination of say tulsi, ashwagandha, kuduchi, and as well as we are looking into, I think, motha. There's a formulation called flexibility. I think it is there in Organic India flexibility. It's a wonderful, great combination, particularly for those who are suffering from autoimmune related arthritis. So we are talking about rheumatoid arthritis, psoriatic arthritis, or you have like swollen, inflamed joint itself. So it actually just works fantastic for those conditions. You can basically Google it and find further details on it. And this can be used for all form of joints. Usually it doesn't interfere with most of the other prescriptions, and the good thing is more or less you can eventually stop your other prescription drugs, because like they are not curing the problem, they're just kind of managing it, so the condition gets a lot better. And in general, there's a lot of dryness when it comes to joints. There's a lot of dryness, and in Ayurveda we call it vata. In vata conditions where the joints are very dry, which is prone for all form of arthritis. So the other thing you can use is basically sesame oil is one of the fantastic supplement you can take internally, and as well as there's a lot of massages. Most of the Ayurvedic places, if you go, they will use sesame oil for the massage. The purpose is to hydrate the skin, lubricate the joints, and it is a very gentle oil. Of course, use a very good quality organic oil, not just random oils, because that can cause a lot of rashes and allergies on the skin. But if the quality of oil is good and organic, it is fantastic for the joints itself. And the other thing you can use is using a little bit of, because when it comes to ghee, organic ghee and butter, there's like 2 sides to it. But my suggestion is, if you don't have any high cholesterol related issues and digestive issues and weight related issues, you can definitely use organic ghee in minimal quantities, especially as a sprinkle on the food. That can also improve your overall joint health, which is excellent as well. And what else I can think of? Sesame oil. Okay, so other than these, there are other things what you can do. Like there are certain kind of foods when it comes to, I think food is the one thing we don't want to skip. There are certain kind of foods which are excellent for protecting and safeguarding your joints. One is the onion family. Onion family means it's basically onion, garlic. These are all excellent anti-inflammatory elements. They are very high sulfur compounds, which is fantastic. So eat a lot of onion and garlic. It's excellent. You can take a lot of green tea. Go look for organic pure form of green tea, because other teas, there's a lot of pollution because they spray a lot of chemicals and pesticides over it. So you don't want to take that. Look for organic green tea and drink that regularly. Organic tea has been proven to be very effective in lowering inflammation of the joints. On the other hand, you can also take, like, this is my favorite brand, so I take like a lot of flax seeds. Well, I'm based in KL, so there's a lot available here, but you can take flax seed powder, or you can take like flaxseed oil. They are very, very rich in omega-3, and those who are okay with fish oil, you can also take like any form of fish oil. So this is something regularly I take also, which is excellent for keeping your joints very well lubricated. It's also fantastic. And on top of that, you can take like a lot of citrus fruits, because citrus, like lemon, oranges, they have very high level of vitamin C, also including amla. So the vitamin C improves the collagen inside of the joint, so the joints stay very flexible and very healthy. So that's also something very good. And on top of that, you can take like omega-3 rich food, like particularly eating fish is totally all right, but look for oily fish, small fish, not the big ones. And also eating a lot of walnuts, which is excellent for the joints. You can take a lot of berries, avocados. I think in India we call it butterfruit. Like avocados are excellent for the joints. So these are all the fruits what you can eat. Okay, so once we have seen what you can eat, there are other things what you can't eat also, which is very important. So what you cannot eat, most important, trans fat. Stay away from hydrogenated fats, the thick fat. I'm not sure about the name of it, but this is something what they usually use it in making like parotas and whatnot. Stay away from it. Avoid it like poison. It's very dangerous for the joints. And the other thing is gluten, like wheat-based products, like baked goods. Stay away from that, because they also sometimes tend to dry up the joints and induce a lot of inflammation. And anything like, we call it like 3 white poison, like white flour and white sugar and excessive salt, which is white in color. So these are all the ones what you really want to stay away from, at least minimize it, which is very important. And there's a general saying like, eat the food that comes from the plant and not manufactured in the plant. So which means if it is growing in the plant, you eat it, it's going to be very good for you. If it is coming from a manufacturing plant with a lot of ingredient list, stay away from it, because it's a processed food. It's not exactly going to be good for you. All right, so that is also something you need to be careful about. And too much of processed meat is not very good. And as well as red meat tend to make this joint related conditions a bit bad, so you also need to be careful about it. And alcohol, really stay away. It's really bad for you. And as well as cheap vegetable oil, roadside they use a lot of this poor quality oils. It's not going to be very good. It's rich in omega-6 and omega-9 that can cause a lot of inflammation, so stay away from that. And the other food is like, we call it AGEs, like advanced glycation end product. So whenever they like grill the meat or grill the vegetable, grilling seems to be bad for the joints, especially when it is meat. So you also want to stay away from that. So those are all the basics. And we have talked about certain herbs. Now let's talk about supplement side of it. Like that's also I'm sure you all are looking forward for that. So supplements, one of the things you can take is something called proteolytic enzymes, like digestive enzymes. We are talking about lipase, protease, amylase. You can buy digestive enzymes, or usually in food, the richest enzyme you can find is usually in papaya. You can also find it in pineapple. Pineapple is one of the richest. It's like, it has called bromelain, which is excellent. In papaya we call it papain, which is also excellent enzyme. These fruits will relieve your pain almost instantly, lowers the inflammation, excellent. The other one is collagen. Collagen, if you're a meat eater, you can take a lot of this bone broth, particularly the animal legs. Bone broth is excellent for the joints in general, particularly if you have arthritis. And omega-3 I talked about, flaxseed oil, fish oil, they all are very excellent for you, keep the joints lubricated. Well, there was a question, I think they're talking about almond milk and soy milk contain lactose. Usually no. Lactose is a milk sugar. It is only found in the milk of like animal, like cow's milk or human breast milk. So usually almond milk and soy milk doesn't have lactose, so you don't have to worry about it. But make sure there is no fructose. They add a lot of sugar, simple fresh sugar. So just if you're buying for a health reason, make sure there's no added sugar in it. That is something you can actually do it. The other supplements, naturally you want to take some calcium and magnesium. When it comes to calcium, the richest natural source of calcium is not milk. Your body doesn't absorb that calcium from the milk that fell. Actually, it is sesame seeds. Sprinkle sesame seeds, roast sesame seeds. Use a lot of sesame seeds, and usually your calcium concentration improves tremendously. All right. And usually all the nuts and seeds, particularly when it comes to zinc and copper, you can take like pumpkin seeds, sunflower seeds, almonds. All these are very high in zinc and copper, so you can take that. And you might have heard about glucosamine, which is very important. Glucosamine, chondroitin, methyl sulfonyl methane, these are all the typical supplements what you can find in most pharmacies, and they work quite well because they are part of integrated joint support. So you can always just take that. And as well as, most vital, take vitamin D3. If your vitamin D3 levels are enough in your body, chances are you won't even develop arthritis. But it is always important to check what your levels are when it comes to vitamin D3. You can also check it through the blood test, but nevertheless, I think most Indians are trying to stay away from sunlight, and they all are trying to stay indoor and never expose themselves to sunlight, so your skin doesn't get enough of chance to produce the vitamin D3. And we are kind of dark skinned, so usually our ability to produce vitamin D is relatively lower, and you have to really stay for like hours, which is not exactly a good idea. So my suggestion is going to be, just take some vitamin D supplement, about 1,000-2,000 international units per day, but very subjective. So you can also take that. And that's a little bit of it's a lot of different information, but I think some of you all may feel very overwhelmed by so much of info. My suggestion is this. There's a saying, don't let perfect be the enemy of good. out of this session, even if you pick up like just few tips and tricks and you just want to start with something, go ahead and start. Don't wait for everything to be like organized and to be perfect in plan. It's not necessary. Any start in a good start. So with that saying, I would like to say thank you. And again, don't let perfect be the enemy of good. All right, so we'll just look into it, and I wish you all the best, and I wish you all a very healthy and a happy life. Thank you so much. Bye bye, and see you all in next session.